relationship with the National Foundation for Credit Counseling actually started about 4 or 5 years ago when we worked with them. So I had a previous study that we did with them where we were developing a financial health checkup tool. So they wanted a tool like what you can get online to check to see, am I at risk for diabetes? They wanted to develop an online tool that could help people check their financial health. And so we, myself and then some colleagues, Cecilia Loibel here in the Consumer Science Department at OSU and Michael Collins at Wisconsin, helped them develop a financial health checkup tool that they called My Money Checkup, that they then subsequently launched online. It's available free to consumers now nationwide. And after we developed that tool, they wanted to kind of develop a more robust evaluation of the services that could be wrapped around that tool, the credit counseling services. So that led to the development of the Sharpen Your Financial Focus initiative that included 3 components, one component of which was this financial checkup tool, and then 2 other components, just financial budget review, and then some type of enhancement. See, you should describe that part. That's my point. But some kind of enhancement to the credit counseling model. So they had hired us to then evaluate that. And at the same time, Stephen was a budding doctoral student who was very much interested in becoming an expert in his own right in consumer financial health issues. And I approached him, and he graciously agreed to take the lead in this project and then use this project as his dissertation research, and took the lead in the evaluation of the project. So
the program was actually a really fertile ground for my dissertation work because, ideally, the type of design for these programs would be a randomized controlled trial, right? But it's difficult to do that with social services interventions for a variety of reasons. But it gave me an opportunity to work with Stephanie, work with the NFCC and the Experian Credit Reporting Bureau to develop a comparison group of individuals who were otherwise very similar to credit counseling clients, but who did not go through counseling themselves. So sort of as a second best option to a randomized controlled trial. And in doing that, it allowed us to compare the outcomes between these counseling clients and similar individuals who didn't go through counseling. And we actually ended up observing a number of interesting things. I think, if I had to sum up the 2 key findings in this study, it would be first, credit counseling clients actually, over the course of the evaluation period, which was about 18 months after they went through counseling, had much lower credit card debt than the comparison group. They had around $3,600 less credit card debt than the comparison group, generally speaking, and this was robust to a number of different controls, looking at a number of different subgroups. And the other thing that we really found was that these clients, when they're entering into these agencies, are already facing a huge amount of distress. So you're already seeing their credit profiles start to deteriorate at the point where they're coming in through counseling, and their credit scores, though they actually become higher by the end of the evaluation period, they're still lagging behind where they would have been had they maybe sought help earlier. So our evaluation and my dissertation work really focuses on a number of policy implications from my credit counseling evaluation, recommendations for practitioners, recommendations for policymakers, and it was really a great opportunity as a doctoral student and as someone who just recently got their PhD from this work, because there was not a lot of work done in this field at all. And so I really felt like I made not just a contribution to the overall policy discourse, but was also able to contribute in, I think, a very concrete way to an important field, and a field that didn't have a lot of research behind it. So it was a wonderful opportunity.
Yeah, and I'd say so before there's a lot of anecdotal evidence to suggest that credit counseling is effective. People will tell stories about how counselors change the lives of individuals that come in to see them. And the counseling industry is quite large. There's 70 nonprofit organizations, for example, that are affiliated with the National Foundation for Credit Counseling. Provide
600 agencies total within these 70 organizations in every state in the country.
And just through the Sharpen Initiative alone, more than 60,000 people have come through the doors of this initiative since we started the evaluation in 2013. 2017. So we're talking a large volume of consumers that seek these services. There's public dollars that are allocated towards this. There's also private dollars. There's also banks that invest in these kinds of services because they believe they're going to make a difference. They believe that by providing people with credit counseling, they're going to be able to better manage their debt. So not only are they getting information about how to budget, but these counselors often work with them and work with their creditors to try to negotiate better payments for them with their creditors, maybe reduce interest rates and fees. So we have this assumption that this is going to make a positive impact on their lives, but it's been really difficult to track that. We don't know empirically if that's true or not. And the research has been kind of inconclusive in the past on whether or not this actually has an impact. So our study is one of the first more rigorous studies to be able to show that on particular metrics like reduction in debt, you do see a reduction in debt at 18 months after receiving counseling for folks that go through this kind of a program. You know, one of the kind of interesting findings is related to credit score. So a lot of times people use credit score as an indicator of financial health. And if you were to just look at a snapshot of credit score at 18 months after, you actually wouldn't see a significant improvement among counseled folks. But Stephen, I don't know if you want to explain why that's true. We actually, through the study, were able to identify why that's the case.
And so this is a big thing. So past research, the very little past research that's been done on that has actually found that there wasn't much impact from credit counseling on client credit scores. And credit scores, as Stephanie sort of mentioned, that's the go-to for a lot of people when they assess an individual's financial health or their riskiness, things like that. And past research really only looked at outcomes at two periods in time, prior to credit counseling and then maybe several years post-counseling, and didn't find much of an impact. What we did, and one of our chief contributions, was to track outcomes over time.
Quarterly.
On a quarterly basis. And what we saw is clients report coming into these agencies not just because they're dealing with debt issues or general credit issues, though most typically they are, but because they're dealing with these issues in conjunction with some sort of economic shock. So you can think of this like an income shock, like job loss or going through a divorce, or an expense shock, such as an unforeseen medical expense that, leads these people to be unable to deal with their existing debt obligations. So they're falling behind on their payments at the point where they're coming into these agencies. And so from them falling behind on their payments, their credit scores are starting to decline. And then what we see from tracking these outcomes over time is that this decline, it tapers off probably about 3 to 6 months after they go through counseling, and then begins rising again. And by the end of counseling, sure enough, their credit scores are higher than they were at the beginning, even with this dip. So one thing we found was that it's not simply enough. And my opinion is that this actually extends beyond credit counseling programs in general, but to social welfare-oriented programs where you're dealing with distressed client bases. If you're going to assess client outcomes, you have to understand what's happening to their outcomes around the time they're seeking these services.
Right.
And so what we found is that that's essential to understanding these people's lives and the ability for these programs to impact them.